Hello, and welcome to Providence, Oregon Region NICU Parent Discharge Education. Whether you are being discharged from Providence St. Vincent Medical Center or Providence Portland Medical Center, this valuable education will assist you and your baby with the transition to home. We will cover many important questions you may have about taking your baby home, including safety, feeding your baby at home, administering vitamins and other medications, general baby care including baths and taking temperatures, and answer any common questions that you may have. Cardiopulmonary resuscitation, CPR. We recommend all families review the American Heart Association AHA Family and Friends CPR ebook and videos. At Providence St. Vincent's Medical Center, in-person family and friends CPR classes may be available. Ask your nurse about signing up. You can purchase an AHA Infant CPR Anytime kit. This comes with a teaching DVD and a practice doll. You can share with anyone who might babysit or provide care to your baby. Breathing and suction. Babies breathe through their noses. When they are stuffy and having difficulty breathing, they may need their nostrils cleared. This is called suctioning. You will go home with a bulb syringe. This is a good tool for suctioning your baby's nose. To use a bulb syringe, squeeze it before putting the tip in your baby's nostril. Stop squeezing once the tip is in their nostril to remove mucus. Avoid inserting the tip too far because it can hurt the inside of their nose. If their mucus is thick or hard to remove, nasal saline solution can help. Place a couple of drops in one nostril. Let it sit for a few seconds, then suction with the bulb syringe. Allow your baby to recover. Repeat if needed on the other side. Emergency preparation. Practice CPR and airway clearance suctioning. Write down important contacts, including your baby's primary care provider and their clinic's phone number. Have your address posted in an accessible location like your front door. Call 911 and follow instructions during emergencies. Poison control. Add the poison control number to the contacts in your phone. Their number is 1-800-222-1222. Home temperature. The ideal household temperature is 68 to 72 degrees Fahrenheit. Keep your baby away from fans and drafts. Be careful not to over or underdress your baby. Safe sleep. Safe sleep reduces the risk of sudden infant death syndrome, otherwise known as SIDS. A baby should always sleep alone, on their back, in a crib or bassinet with a firm mattress and a tight-fitted sheet. Avoid placing blankets, pillows, toys, or other positioning devices in the crib or bassinet. Sleep sacks are recommended until the baby is 3 months of age. A clean, dry pacifier can be offered to help your baby fall asleep. Crib slats should be no wider than a soda can. Avoid exposing your infant to smoke. Avoid smoking in the house or car. Wear a jacket or other garment when smoking. Remove it when finished and wash hands prior to returning to care for your baby. Car seat safety. Always place your baby in a car seat when they are in a car. Car seats should be rear facing until your child is at least 2 years of age. Only items which come with the car seat should be used, such as strap covers and inserts. No other items should be used. Car seats should only be used in the car. Infants should always be buckled in when in a car seat. Never leave your baby unattended in a car seat. Do not allow your baby to sleep in a car seat. Place a needed item in the back seat, such as a purse or phone, so you do not forget your baby in the car. Car seat fit. Snug as a hug. Shoulder straps should be at or below your baby's shoulders in all rear-facing car seats. When tightened, you should not be able to pinch straps. The chest plate or clip should be at the level of the armpits. Coats and blankets should not be under straps while in the car seat. If it is cold, wrap a blanket over the top after buckling in your baby. Remember to adjust straps as your baby grows. Most car seat makers have installation videos online. Check the car seat and your car manuals for best installation. A car seat video is available on our unit's YouTube site. Ask your nurse how to view this. Safety and childproofing. Now is the time to go through your home. Insert outlet covers in empty wall outlets. Install locks on drawers and cabinets. Secure cleaning supplies and medications. Secure dangling cords, windows, and sliding glass doors. And install baby gates. Never leave your child unsupervised. Choking hazards. Infants should not wear jewelry. Jewelry includes religious pins, necklaces, rings, and bracelets. We recommend waiting to pierce your child's ears until they are 4 years or older. Check for buttons, ribbons, beads, or small parts on clothing, hats, and toys. If items can pass through a toilet paper roll, they are too small for your baby. Feeding your baby. When ready for discharge, your baby will be on an on-demand feeding schedule. This means they will set their own intake. They may have as much food as they want. They can eat when they are awake and hungry. You should plan on feeding your baby every 2 to 4 hours. You may need to wake young babies at the 4-hour mark for feeding. If your baby is on fortified breast milk, you can mix enough for 24 hours and store in the fridge. NICU staff will give you instructions for mixing formula or fortifying breast milk before discharge. Bottle feeding. Clean bottles and nipples are important. Use hot water and soap or a dishwasher to clean bottles and pacifiers. Do not microwave a bottle with breast milk or formula. This can create hot spots which can burn your baby's mouth. Discard any remaining formula or breast milk in the bottle after your baby is finished eating. And never prop a bottle to feed. Here is a QR code from the CDC on how to clean, sanitize, and store infant feeding. Mixing powdered formula. Start with cold water. Bring water to boil on the stove for 1 minute. Measure and pour correct amount of hot water into a clean bottle or food-safe mixing container. It is okay to cool water a bit, but not more than 30 minutes. Next, measure and add powder to the hot water. Place nipple and lid on the bottle. Shake well to mix. Cool formula to room temperature before feeding your baby. For more information on infant formula preparation and storage, you can use this QR code to go to www.cdc.gov. Breastfeeding support. Most babies increase nursing frequency and volume over time, which is expected and great. Weight gain should be monitored by your primary care provider or at the postpartum care center. Lactation consultants are available for up to a year after discharge. You can call the Providence Postpartum Care Center at Providence St. Vincent 503-216-4033 or Providence Portland 503-215-6085 for free support. Is my baby eating enough? Babies will show hunger cues such as sucking on their hands and rooting. If you have nursed on both breasts and your baby is still hungry, you can follow up with a bottle. Babies should have 6 to 8 wet diapers a day. Babies may not have a bowel movement each day. They should be eating well, not throwing up more than just a normal spit up, and be comfortable. If baby is having small, firm, pebble-like stools and is uncomfortable, consult your primary care provider. Vitamins and other medications. Try to give medications at the same time every day. Vitamins and most medications can be mixed with 10 to 20 milliliters or 2 to 4 teaspoons of breast milk or formula. Have your baby drink this first, then follow with the rest of the feed. Some medications cannot be taken with food. You will need to place these medications directly in your baby's mouth. Taking your baby's temperature. A digital thermometer is preferred for babies. Place the thermometer tip in the armpit and keep secure until it beeps. Your baby's temperature should be 97.7 to 99.6 degrees Fahrenheit. Avoid using forehead thermometers until babies are at least 3 months of age. Avoid ear thermometers until babies are at least 6 months of age. Bathing. Bathe young babies 2 to 3 times per week. Clean your baby's face, neck folds, and bottom daily or more often if needed. Gather supplies prior to bath and have within arm's reach. Water temperature should be warm, around 101 degrees Fahrenheit. Bathe in a warm, non-drafty area. Consider a swaddle bath to keep your baby warm. A swaddle bathing video is available on our NICU YouTube site. Ask your nurse how to view. Never leave your baby unattended in the bath. Outings. Babies lose most of their heat from their heads. When it is cold, have them wear a hat when outside. Always supervise your baby when they are wearing a hat and never use a hat during sleep. Use sun hats and shade when it is hot outside. Babies younger than 6 months should not be placed in direct sunlight. For infants older than 6 months, sunscreen may be used. Front packs are a great option if your baby meets minimum weight requirements. Avoid using slings for premature infants, even after they reach term age. Bring enough supplies with you for your outing: diapers and wipes, extra clothing and blankets, pacifier, bottle and milk or formula if bottle feeding. Preventing head flattening. Place your baby's head at one end of the crib one night and the opposite end the next night. Place a mobile over the crib to encourage your baby to look straight up at it without turning their head to one side or the other. Remove this when your baby learns to roll. Encourage your baby to turn their head in either direction when they are eating and playing. Provide lots of cuddle time with your baby upright on your chest or in a front pack. Front packs can be used with the baby after their due date and when the minimum weight requirement on the front pack is met. Crying. Crying is a baby's main form of communicating. Things you can do if your baby is crying: feed or burp your baby, check their diaper, suction their nose if they are stuffy, avoid doing this too often, swaddle and or reposition your baby, rock your baby or hold them skin to skin. Babies will cry and there is sometimes nothing to make them happy. It is okay to put your baby in their crib and let them cry for a bit. Period of purple crying. Babies cry, sometimes a lot. Crying is normal but can be frustrating. Normal crying behavior is discussed in the period of purple crying. Please view this video if you have not already. Your nurse can help you with this. We expect crying behavior will increase after discharge. Remember, crying doesn't hurt a baby. Picking them up and shaking them to try to make them stop crying can hurt a baby. Now we will review common concerns after discharge, including diaper rash, diarrhea, cradle cap, the umbilical cord, and RSV and other common illnesses. Diaper rash. If your baby gets a rash, use a diaper cream to treat and protect the diaper area. Clean the diaper area well with diaper changes, but avoid scrubbing the skin. If a rash worsens or does not get better in 3 to 4 days, call your primary care provider. A medicated cream may be needed. Diarrhea. Diarrhea is a watery stool or a stool with a large water ring seen in the diaper. It can be related to food intolerance or illness. Notify your primary care provider if baby has several watery stools in a short period of time. Your baby can develop dehydration quickly. Cradle cap. Cradle cap is common in newborns. It is caused by an abnormal production of oils from hair follicles. It often resolves on its own. Washing hair and scalp with mild soap daily can help it resolve more quickly. Umbilical cord care. Let the cord fall off on its own. Do not try to pull it off. Keep the cord area clean and dry. Dry the cord and surrounding area well, especially after a bath. Do not bathe your baby in a tub until the cord area is healed. If you notice leaking around the cord, a foul odor, or redness, call your primary care provider. Respiratory syncytial virus, RSV. RSV is the leading cause of hospitalization in babies under 1 year of age. RSV causes a lot of mucus production, which can clog the baby's airways, causing them to struggle with breathing and eating. Some NICU babies are eligible to receive injections to help prevent RSV. Your baby's NICU doctor will discuss your baby's eligibility for this medication with you. Other illnesses. Call your baby's primary care provider if your baby is not eating well, is vomiting or having diarrhea, has less than 4 wet diapers in 24 hours, has a fever or a temperature over 100.4 degrees Fahrenheit, is not able to be calmed, or is having trouble breathing. Immunizations. The first hepatitis B vaccine is usually given in the hospital. Most immunizations start at 2 months of age and are given by your primary care provider, not correcting for premature age. We recommend the whole family receive vaccines for whooping cough, aka pertussis, COVID, and influenza during cold and flu season. Visitors, relatives, and siblings. Avoid crowds, especially during cold and flu season. Good hand washing helps prevent the spread of cold and flu viruses. Anyone touching or holding your baby should wash their hands first. Keep visitors and siblings away from baby if they are ill or have cold, flu, or COVID-like symptoms. Encourage siblings to help with baby cares. Older siblings may change their behavior when the baby comes home. Some show younger behaviors like wanting a bottle or pacifier even when they haven't used one in a while. If your friends and family are eager to support you, ask help with meals, errands, laundry, or childcare for older siblings. Primary care provider. Please choose a primary care provider for your baby and let your care team know their name and the clinic's name. This allows our NICU providers to update them about your baby and makes discharge easier. You will need to make a follow-up appointment before you go home. Most babies are seen in 1 to 3 days after discharge from the hospital. Pets. Introduce your pet cautiously. Bring home a blanket used by your baby to allow your pet to get used to your baby's smell. Never leave your baby unattended with your pet. Do not let your pets sleep with your baby. How did we do? We value your feedback and will use it to make changes in our care. After your baby is discharged, we may reach out by phone, text, or email to ask you to take a survey about your time in the NICU. Please feel free to ask us any questions that you may have related to your transition to home.